ನನ್ನ ಹೆಸರು ದೇವೇಂದ್ರಮ್ಮ ರೀ. ನಾವು ಅಲ್ಲಿ ಯಾದಗಿರಿ ಜಿಲ್ಲಾದಲ್ಲಿಂದ ಬಂದೀವಿ ರೀ. ನನಗೆ ಹೊಟ್ಟೆ ನೋವು ಆಗಿತ್ತು ರೀ 6 ತಿಂಗಳಿಂದ. 6 ತಿಂಗಳಿಂದ ನೋವು ಆದ್ರೆ ಅಲ್ಲಿ ನಾವು ರಾಯಚೂರು ಹೋಗಿ ತೋರ್ಸ್ಕೊಂಬಂದೀವಿ ರೀ. ಅಲ್ಲಿ ಏನು ಹೇಳಿದ್ರು ನಮಗೆ ಕ್ಯಾನ್ಸರ್ ಆಗ್ಯದಂತ ಹೇಳಿದ್ರಿ. ಕ್ಯಾನ್ಸರ್ ಆದ್ರೆ ಇಂತಲ್ಲಿಗೆ ಹೋಗ್ರಿ ನಾರಾಯಣ ಹೃದಯಾಲಯಕ್ಕೆ ಹೋಗಿ ತೋರ್ಸ್ಕೊಂಬರ್ರಿ ಅಂತ ಹೇಳಿದ್ರಿ ನಮಗೆ. ಅಲ್ಲಿ ಹೋಗಿ ಹೇಳಿದ್ರೆ ನಮ್ಮ ಆ ರೋಗಿತ್ತು ಸೋರನ್ನ ಮ್ಯೂಟ್ ಮಾಡಿ ನೋಡಿದನ್ ರೀ. ನೋಡಿ ಆಪ್ರೇಷನ್ ಆಯ್ತು ರೀ. ನಮಗೆ ಆರಾಮಾಗ್ಯದ ರೀ.
This was a 50-year-old lady who came to us all the way from Yadgiri, which is in North Karnataka. She had complaints of bleeding through the vaginal area, and there was a biopsy report which was showing cancer, which is a type of cancer called squamous cell cancer of the cervix. Now cervix is the mouth of the uterus, and it is one of the commonest cancers to occur in women, especially in our country. After necessary investigations, which included an MRI scan, we found that the disease was an early stage one. So we decided to offer her a surgery which is called a radical hysterectomy, which involves removal of the uterus along with a part of vagina, along with both the ovaries and a significant length of the parametrium. Now parametrium is a lateral tissue which connects the uterus to the pelvic walls. Along with this, you also need to remove the lymph nodes, which basically drain the cancer cells from the cervix. Now normally this surgery is done using the conventional Opal techniques, but since the tumor was pretty early stage, we decided to offer her the surgery through using the robot. The surgery went quite well. The blood loss was minimal. She was shifted immediately to the recovery, and she started feeding immediately about 6 hours post surgery. She was very comfortable as far as the pain was concerned, and we could manage to discharge her on the 3rd day. Normally in an open surgery, the patient would stay in the hospital for about 7 to 8 days after this procedure. So this was quite cut short, and she was back to her routine activities about a week's time after surgery. Today today is her 20th post-operative day. Her final histopath has come, which reveals a very early stage cancer. So she doesn't need any further treatment, but she will be on follow-up. Her recovery has been quite good, and she is doing well, and she is happy to be cured of the cancer.
ಯಾವ ಕ್ಯಾನ್ಸರ್ ಇದ್ರೂ ಕೂಡ ಇಲ್ಲಿ ವಾಸಿ ಮಾಡ್ತಾರಂತ ನಮ್ಗೆ ನಂಬಿಕೆ ಆಗಿದೆ. ನಂಬಿಕೆ ಯಾಕೆ ನಮ್ಮ ಅಮ್ಮಗೆ ಆರಾಮಾಗಿದೆ ಈಗ ಆಲ್ರೆಡಿ. ಅಮ್ಮ ಎಲ್ಲ ಚೆನ್ನಾಗಿದ್ದಾರೆ ಸರ್. ಈಗ ಏನಿಲ್ಲ ಆರಾಮ ಊಟ ಮಾಡ್ತಾರೆ ಎಲ್ಲ. ಇವಾಗ ಮಾತ್ರ ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ. ಮೊದಲದು ಹೊಟ್ಟೆ ನೋವು ಗಿಟ್ಟೆ ನೋವು ಯಾವ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ.